referred to as sitting in an Indian position, which I'm not sure is politically correct anymore. But since, if you're like me, it's getting harder and harder to get up off the floor, and sometimes you just say, oh, maybe I'll just stay down here for a while. We'll just let that term go. You can also perform this, and we'll try it in a chair, hands on your knees, feet flat on the floor, or in a worst case scenario, you know, if you're in bed, you just keep your legs together and your hands at your side. Now the reason for this, theoretically, is that they call your hands and your feet, or your arms and your legs, four gates, meaning when the energy in your body can come out through your hands and through your feet, your legs. Like, for example, in the martial arts, the striking arts, if you're punching or kicking. The idea being that if you're hitting with one hand, the other hand should be touching your body or touching the opponent, so that the energy from your body is only coming out of the limb that you're using. So that's why seated, hands on the knees, are at your side, so the energy, theoretically, is in your body. Now, your center, the center of your body, but also, as they say, the center of the universe, is called your 1 point. In Chinese, it's called Tantian. In Japanese, Saikano Iten. In Hindi, it's Hara, not horror. And it's, you know, pretty much a staple of all types of meditation and all Eastern concepts. Now, all energy and balance, etc., starts and ends here. Oh, you know, I'm sorry. I'm just thinking. I have some handouts, just general outline, and I put a card on it, name and a phone number and an email address. So if anybody has any questions, they can feel free. I don't know how many are there. See, to you know, give me a call. Yeah, what do you think? That's it. So I'm not using it. Just in case. Great. Thanks. Just a general outline. Okay, we'll try some of these over. As I said, I'm just waiting. All movement, all activity comes from your center. In Western society, we always call it your center of gravity. Right. Located 3 inches below your navel. Okay, let's try this. The first is small orbit breathing. It's the most basic breathing pattern, and I'm sure some of you have learned it in other lectures that you've had and activities. I understand Bobby taught a lecture on meditation here, yoga. It's all very similar. Let's try this. You can sit comfortably, you know, with your feet on the floor and your hands on your legs. And you inhale slowly through your nose. Picture anything going down your spine through what is your 1 point, up the front of your body and out of your mouth. So slowly, in, down your spine, through your 1 point, up the front, and out your mouth. This pattern is called spinning the wheel. Some people picture flowing water or some fire, but fire in your body. I'd like to go with the water. This pattern helps you to relax yourself as a basic relaxation exercise. So I start out at a nice, comfortable, slow speed. And what you try to do is, you know, and don't ever gasp for air. You know, don't force yourself. But go as slowly as you can. And as an exercise, you can try to lengthen that cycle. Like, in other words, so you can even, you put a watch, you look at the watch and you watch a second hand, and let's say the first inhalation lasts 10 seconds and then 10 to exhale. Try to lengthen it, try to make it a little longer each time. You know, not only will you relax, but your heart rate will slow down, and with increased use, you know, even your blood pressure will come down. The next breath is called reverse orbit breathing. It's sometimes called a cleansing breath, the idea of clearing out. As you might imagine, this is done in the reverse. You breathe in through your mouth, down up your spine and out your nose. Let's try that a couple of times. So just into your mouth, down the front of your body, through your one point, up your spine, and out of your nose. And the theory, what you're visualizing is, you know, clearing your body out, preparing for an activity. Try a couple of times in, and then out. And as I said, this is done to prepare for an action, a movement, physical or mental task. You can prepare for your small orbit breathing. Like, in other words, you can just inhale to do something and then exhale for the activity. But if you really need to prepare or you want to concentrate, you do a couple of the reverse orbit breaths first to prepare, and then you inhale through your nose, you get ready, and you exhale from your mouth. I think that's enough said on that. You just, again, make sure that you're comfortable and you're relaxed during the process. All right, the next thing on the list, we believe that there are three types of energy in the body and around: accepting, withstanding, and expanding. And to understand the use of these three, it's directly related to the two breathing patterns. Now, accepting energy is the most passive form of energy. And just as it sounds, allows you to calmly and peacefully accept minor trauma or outside influences. It even impacts on your mood. When a martial artist parries an attack, lets it go by, and lets the opponent pass by, guides them to the ground or whatever, this is accepting energy. And in your daily routine, if, let's say you, like you bump your shin, I'm sorry, I'm losing my train of thought. Well, let's go this way. When a martial artist, as I said, parries to the ground, this is accepting energy. In your daily routine, you will often experience things that would be dealt more efficiently if you understand this energy. The old expression, take a deep breath and count to 10, make it a small orbit breath. If you stub your toe or you bump your shin, you inhale through your nose, and as you exhale through your mouth, you picture the pain leaving your body with the exhalation. I'm sure you've done that. You exhale, comes out, and it obviously, with, God forbid, more severe pain, very, very useful. And as you practice it, you find it really, it just gives your mind a focus on how to deal with this pain, rather than just accept it or have it be traumatic. If, or should I say, when we go for blood work, which is regularly, if you've experienced pain, if you don't get used to it, eventually you just get so used to it. But if you don't, you use this breath pattern to not only ease the pain, but to deal with like any apprehension you have or fear. Before the technician inserts the needle, you inhale, and then as they insert the needle, you exhale, picturing the pain travel from the point right up and out of your mouth. Likewise, if you've been, let's say you've been on the phone with Comcast, and and for an hour and a half, and you're getting ready to tell the customer, the representative, what to reboot. You just do several slow breaths, let the anxiety flow out. Because if you tell them to go to hell, they're just going to disconnect you, and you're going to have to pull back and start all over again. Can you think of any other examples of what might be passive, the use of passive breaths in a relaxation sense?
When you almost have an accident, somebody stops short in front of you and all your muscles tense up.
That's perfect. That's perfect. Right? Your heart rate goes up, and you take a moment. You focus yourself, or sometimes there's this screaming and yelling afterwards, people yelling at each other. Before you do that, my wife's looking at me. I don't do that anymore. I'm all too old. You let the lawyers handle it. But that's perfect. You just relax, and it usually only takes a couple of cycles, because there's more, not just the physical breathing, but it's the idea that you have some way of focusing